Hi everyone, this lesson is on what to avoid when taking gabapentin. So most of the things we're going to talk about in this lesson are going to worsen the side effects of gabapentin. So these can be things that we can consume or other medications. So these are things that we want to avoid when taking gabapentin because it can worsen, in some cases, significantly worsen side effects of gabapentin use. Before we talk about those things to avoid, let's discuss what gabapentin is. Gabapentin is also known as Neurontin. It is a gamma-aminobutyric acid or GABA analog. So it's an analog of a neurotransmitter, and this is an inhibitory neurotransmitter. So in fact, GABA is the primary inhibitory neurotransmitter, which means that it's going to inhibit neuronal functioning in general. Now, gabapentin is going to be used for particular conditions. Most often it's going to be used to treat partial seizures and for post-herpetic neuralgia. And post-herpetic neuralgia is neuralgia that occurs after herpes infections. So these are going to be the main conditions that we use gabapentin for, but there are many other off-label uses. So these include restless leg syndrome, fibromyalgia, diabetic neuropathy, and irritable bowel syndrome or IBS. So again, this medication is used for many different conditions, although it's going to be considered off-label. Now, the problem with gabapentin is that it can cause a variety of mild and or severe side effects. These include drowsiness, fatigue, dizziness, and ataxia, among others. So this makes sense. If we're leading to general inhibition of neuronal functioning, we can lead to drowsiness and fatigue and dizziness and some of these other symptoms. So these are going to be side effects that make sense when using this medication. But the problem is that there are many other things that we can consume and other prescription medications that can worsen side effects of gabapentin. So for the most part, a lot of the things we're going to talk about in this lesson cause similar side effects as gabapentin. So when taking gabapentin and these other things together, the side effects can become more severe and in some cases very severe. So we have to talk about these things and we should have tried to avoid or limit their use when taking gabapentin. The first things we're going to talk about that should be avoided with gabapentin use is alcohol or ethanol consumption. So alcoholic beverages, beer, wine, any other kinds of liquors. The reason is because consuming ethanol or alcohol with gabapentin together can interact synergistically, meaning that they enhance each other's effects more than they increase effects more than expected. So what happens is that alcohol increases the central nervous system effects of gabapentin, so the dizziness, the drowsiness, etc. So taking gabapentin with alcohol can significantly worsen dizziness and drowsiness from the gabapentin use. So this is something that should be limited or avoided with gabapentin use. A particular herbal supplement that can interact with gabapentin is valerian or valerian root. So valerian can be used as a herbal treatment for restless leg syndrome. And as mentioned before, restless leg syndrome is one of the off-label uses of gabapentin. So when taking valerian and gabapentin together, they can cause similar side effects. So in addition to gabapentin, if we're taking both of them, they can significantly worsen the side effects of both of them. So the dizziness, the drowsiness, the fatigue, etc. So it can increase the risk for falls, for instance. So again, very important to limit or avoid use of valerian. Now, some prescription medications that can interact with gabapentin use include opioids and derivatives. So certain opioid and opioid-like medications can have significant interactions with gabapentin. These include fentanyl. So for using fentanyl, say for instance in cancer patients for the pain from cancer, fentanyl and gabapentin both cause significant drowsiness and sedation. Again, combining them worsens this effect. Buprenorphine is a partial mu receptor agonist, so it can have similar effects on sedation. So having buprenorphine with gabapentin together can significantly worsen sedation as well. And then some other opioids include hydrocodone and morphine. These, again, both cause similar effects, including sedation and drowsiness. So taking these with gabapentin is going to worsen gabapentin's side effects. Another medication that can interact with gabapentin is zuranolone. So zuranolone is going to be used to treat postpartum depression. So using in combination with gabapentin can worsen the drowsiness and the central nervous system depression in a synergistic manner. Again, not be an additive effect. It's going to cause drowsiness more than expected. We can also see similar side effects and worsening of side effects when taking gabapentin with benzodiazepines. So benzodiazepines are going to be used in treatments of anxiety disorders, especially very acute short-term anxiety disorders like panic attacks or certain phobias, for instance. So examples of benzodiazepines include alprazolam, clonazepam, diazepam, lorazepam, and midazolam. So you can think of medications with the suffix lam, but especially with the suffix pam, these are going to be benzodiazepines. And again, they act synergistically to suppress central nervous system activity. So especially with benzodiazepines, when these medications are taken, if they're taken chronically, they're not taken for acute periods of time, patients can become very tolerant to their effects and require higher and higher doses to get their response that they're looking for, that anti-anxiety response. So using benzodiazepines with gabapentin, we have to use caution. So oftentimes what can happen is the benzodiazepines can worsen central nervous system depression to the point where it increases risk of respiratory depression. So this can be very significant and severe. We have to watch out when using benzodiazepines with gabapentin because of this potential risk. We can also see interactions with SSRI and SNRI antidepressants. So SSRIs are selective serotonin reuptake inhibitors, SNRIs are serotonin norepinephrine reuptake inhibitors, and other types of antidepressants, which we'll discuss in the next slide. Some of these include citalopram, escitalopram, fluoxetine, fluvoxamine, and desvenlafaxine. So desvenlafaxine is the SNRI here, and the other ones are SSRIs. And again, we have to use caution when taking these medications with gabapentin because it increases risk of respiratory depression, especially when we're taking high doses of both. So important to use caution when taking both types of these medications. Some other types of antidepressants that can worsen side effects of gabapentin include the TCA antidepressants or tricyclic antidepressants. Examples include amitriptyline, clomipramine, disipramine, and imipramine. So you can think of medications with the suffix triptyline or pramine. So again, these act synergistically with gabapentin, and these two also increase the risk of respiratory depression. So it's important to look out for these medications, especially because TCA antidepressants like amitriptyline can be used to treat conditions that gabapentin treats. So they can treat similar conditions, have similar effects, so we want to check to make sure a patient's not taking both, for instance. So in diabetic neuropathy, for instance, gabapentin can be used to treat the symptoms of diabetic neuropathy, but amitriptyline can also be used as well. And other antidepressants that are not in the classes we just mentioned can also worsen the side effects of gabapentin. Gabapentin can worsen the side effects of these particular antidepressants. These include antidepressants like mirtazapine and trazodone. Again, they act synergistically to increase the risk of respiratory depression. That's going to be the major side effect we want to look out for. Some other medications that can interact with gabapentin include antihistamines. Antihistamines block histamine receptors, and especially if they block central histamine receptors, meaning that they block histamine receptors in the brain, they can cause sedation, which again is a similar side effect as gabapentin causes. So antihistamines are commonly going to be used to treat allergy symptoms, motion sickness, and nausea. And some examples can include cetirizine, desloratadine, dimenhydrinate, dimenhydramine, and loratadine. So dimenhydramine is going to be Benadryl, loratadine is going to be Claritin. So taking antihistamines with gabapentin can increase the risk of respiratory depression as well, so we want to avoid taking especially high doses of both of these types of medications. And then antipsychotics are also another class of medication that can interact with gabapentin. So some antipsychotics can interact with gabapentin. These include lorazepam and bexapiprazole. Again, these also increase the risk of respiratory depression. And then certain sleeping medications can also interact with gabapentin. We talked about the fact that gabapentin causes drowsiness and sedation, and that's what sleeping medications do as well. So taking both of these together can worsen the side effects or the effects of each other. Some of the sleeping medications that are especially advised to avoid or limit use with gabapentin include Ramelteon, Zeleplon, and Zolpidem. Again, these also increase the risk of respiratory depression by acting synergistically with gabapentin. If you want to learn more about gabapentin's side effects, please check out my lesson on that topic. And if you haven't already, please like and subscribe for more lessons like this one. As always, thanks so much for watching, and hope to see you next time.